I am passionate about being an osteopathic surgeon and using osteopathic principles and practice, osteopathic manipulative treatment or OMT, for my surgical patients. I've been a surgeon now for almost 20 years, and the application of osteopathic principles and practice to my surgical career have given such tremendous outcomes for my patients, and my practice has been so much more satisfying because of it. I have found two ways that we can best apply OMT and osteopathic principles to the surgical arena. The first is perioperatively. When you've got a chronic surgical disease or an acute surgical disease, that already creates an uptick in your sympathetic tone. And then we add the trauma of a surgery, an operation that causes pain, that requires so many different chemicals the body's not familiar with, malpositioning, intubation. All these things add to the already pre-existing sympathetic tone. And it is a great asset to be an osteopathic surgeon who can then modulate that autonomic nervous system, decreasing the sympathetic tone, increasing the parasympathetic tone, giving patients better rest, less pain, better breathing. Altogether, doing osteopathic manipulative treatment in the perioperative period can help decrease length of stay, it can improve pain control, it can help patients feel overall more wellness. The second most common way that I use OMT in the surgical field is for trauma victims. Patients who have suffered major trauma have had a lot of forces applied to their body that cause distortions in that body, really an accumulation of multiple somatic dysfunctions. And using your hands to be able to undo that force, get rid of those somatic dysfunctions, can relieve pain both acutely and chronically and improve overall mobility. This can be something that can help patients who have suffered a long time with post-traumatic injuries, or can relieve immediately somatic dysfunctions that have contributed to, let's say, neurovascular dysfunction, like a seatbelt injury causing traumatic thoracic outlet syndrome. It's been my practice to treat those cases immediately in the trauma bay with return of neurovascular function. Overall, being an osteopathic physician who does surgery has really transformed how I see patients. The art of touch has developed so much more empathy and has really opened doors to creating therapeutic relationships with patients. And I find it to be a truth that there's no better person in the hospital to do osteopathic manipulative treatment than surgeons whose hands are already meant to be the most sensitive and the most facile of all the physicians in the hospital. I really value being an osteopathic surgeon, and I hope you do too.